Dilation of venous blood vessels leads to a decrease in cardiac preload by increasing venous capacitance. Nitrates are commonly used venous dilators to reduce preload for patients with chronic HF. Arterial dilators, such as hydralazine, reduce systemic arteriolar resistance and decrease afterload. If the patient is intolerant of ACE inhibitors or beta blockers, or if additional vasodilator response is required, a combination of hydralazine and isosorbide dinitrate may be used. A fixed-dose combination of these agents has been shown to improve symptoms and survival in Black patients with HFrEF on standard HF treatment, beta blocker plus ACE inhibitor or ARBs. Headache, hypotension, and tachycardia are common adverse effects with this combination. Rarely, hydralazine has been associated with drug-induced lupus.